conference is important considering the issue of gender discourse in the global context. Gender equality is an important topic in today's global discourse on development. Gender equality is not just a right, but it is something that we feel that it is very, very important. Women are seen as a group of people that are not given equal opportunity as men. However, women play an important role in societal development. Removing gender gap has been seen as a way for global development. So taking this title as the title of this international conference is an important one. And holding the conference in this great polytechnic, Auchi Polytechnic, is very, very historic. The Polytechnic has been playing a great role in the polytechnic education in Nigeria. I want to digress a little bit. When we talk of polytechnic in Nigeria today, when you mention 1, 2, 3, before you mention 3, you will mention Auchi Polytechnic, yes, as one of the best. And this cannot be unconnected with the leadership style of the rector, Dr. Mrs. Philippa Idoho. She has greatly transformed this polytechnic since she took over the leadership some years ago. We have seen this in different aspects of the development of the polytechnic. Now, extending this to gender equality. When women are given roles to play in the society will develop fast. The achievements of Dr. Mrs. Philippa Idoho is a good example of what women can do in our society. Her achievements are very, very inspirational, not only to the women folk, but to the entire society. So this conference is coming up at a right time. And the conference is going to focus on how to give women folk equality, to make them equal as men, for them to have equality like they are men folk, to have equal access to education like men, to have equal access to health like men, to have equal access to resources like men. For instance, Nigerian farmers, women are more than 40% of Nigerian farmers, but less than 10% of women are landholders. So when women are given equal opportunity like men, the society will make faster progress. So I believe that different presenters of papers at this conference, international conference, are going to discuss different areas where the society can make impact in giving women equal roles to play in the society. Once again, I want to thank the organizers of this conference for giving me the opportunity to be part of this conference and also to chair the conference. I also want to thank Dr. Mrs. Philippa Idoho for hosting this conference at this time. I also to thank her, to congratulate her for the great job she is doing in this polytechnic. I've moved down this morning. I've seen a lot of projects going on. Yes, and we have seen what you have done in the past, what you are doing presently, and I believe this polytechnic has great future with this work that is going on here. I also want to say this, that this polytechnic is one of the most stable polytechnics in Nigeria. While many other polytechnics are closed down now, academic works are going on here. So this is great. I know managing Polytechnic and other tertiary institutions in Nigeria is a very challenging task. But for her to have effectively managed this place, it is a great thing for the women folk. And she is an inspirational leader, not only for the women folk, but for the entire people in Nigeria. Once again, thank you and God bless.
Professor Auchi, Her Royal Person, the Auchi of Auchi, distinguished awardees here present, members of the Alumni Association of Auchi Polytechnic, principal officers, deans, directors, heads of various units here present, students of Auchi Polytechnic, of the press, distinguished ladies and gentlemen. It is with much pleasure that I join the director of the Center for Gender Studies in welcoming all guests to this multidisciplinary conference. I welcome our distinguished lawmakers, academics, and other participants to this conference, which I believe will open new frontiers for the understanding and appreciation of gender-related issues. At the mention of gender studies, what readily comes to mind is the issue of women, their plight, their discrimination, and even subjugation within cultural settings. Those who think this way may be right, but the issue of gender studies is not limited to women. It includes men, their challenges, and opportunities available to them. I recall that at a meeting, a rector of the Polytechnic in one of the eastern states in Nigeria remarked that the problem in his area was how to win males off taking too early to business and making money and getting them to school to acquire a level of higher education. To him, the challenge was increased male enrollment in school. Notwithstanding this, the general belief, at least in Nigeria and in many African countries, is that women are not availed equal opportunities to education and access to power, especially political power. Time was in this country when given the option to train a male child and a female child, the parents will rather opt to send the male child to school and marry off the female child. Time was in this country when the girl child in her very early puberty is offered in marriage with the probable consequence of health complications like VVF, that is, viscovaginal fistula. The poor and even disdainful treatment of widows in certain parts of our country and the restricted access to certain professions were other observations in gender treatment. Time was when the woman was a full-time housewife or teacher, but not a pilot, engineer, or leader in the conglomerate. However, over time, changes have been noticed in the treatment of women. With enlightenment, the society appears to be taking a more benevolent attitude to issues concerning women and the role they should or ought to play in society. With many non-governmental advocacy groups and international advocacy bodies taking on the cause of women, the society appears to be easing its fetters on women. Gladly, the girl child is now offered the opportunity to go to school and even reach the apex in academic attainment. Women are now found in boardrooms, with some being chief executive officers. Women are now in all the professions, even in those hitherto perceived to be exclusive to the male folk. Now, more women are becoming ministers, legislators, and special advisors. No woman, though, has become a governor or president in this country. That they can now aspire is a good omen, and with time, women will soon appear as governors in government houses and possibly as it may be remarked that the gains of women in the political and professional space is still too little and too late. Yet, it must be understood that it is better today than it has always been, and it is better late than never. The resistance to women ascendancy was both cultural and religious. Working together, both factors assumed that the society is better off and more stable with women staying at home and minding the children. The society presumed that a child belongs to everybody, and it was the responsibility of all to mind the child. The protagonists of this hold that the society was more orderly, that divorce rate was low, that criminality was low, that alcoholism was in check, that suicide was less, and that rape was rare. They believe that society is falling apart because those who ought to man the home and watch our children as they grow are now taking on responsibilities not envisaged for them until the coming of advocacy groups which propagate the concept of equality of sexes. Well, maybe. The reality of our time is that modernity has broken down cultural barriers, its relativity, and offered a better understanding or interpretation of religious precepts. Society is organic. It grows. If criminality, divorce, alcoholism, rape, and suicide are now manifest, it cannot be traced solely to gender equality. Deviant elements and tendencies have always been part of society. With increased population, the possibility of deviant manifestation also will necessarily increase. In any case, deviant behavior is not proportionally significant in any society compared to the general population. All said, these manifestations create opportunities for research for the centers for gender studies across the country. The federal government of Nigeria must be commended for the signing into law of the anti-gay legislation. Same-sex marriage is culturally abhorrent and alien to us. No liberal interpretation of religious precepts has yet found justification for the consecration of matrimony between same sex. Rather, the holy books are replete with destruction, as a consequence of same-sex intimacy. Besides, same-sex marriage does not regenerate society. It effectively destroys its moral fabric. Finally, we must pay tribute at a conference like this to women of the ages who demonstrated that women are as relevant to societal growth and development as their male counterparts. We must put our hands together for Queen Lydia of Edo, for Moremi, and for Amina. Even in recent history, we must acknowledge the exploits of Funminayo Rasamkuti, Margaret Eku, Gambo Sawaba, and many others in towns and villages across the country who have contributed positively to society. Above all, we must appreciate our male folk for acknowledging that men and women build a society. Thank you for listening.
Using mobile phones and blended learning methods, she, along with other members of a microfinance group, learned about business and credit planning, approached the bank for a loan, and started an enterprise. She is now an active member of a women's federation, has started a primary school in the village, and is a committee member managing the school. Her personal income through goat rearing has increased considerably. She is not only able to learn daily through her mobile phone, TV, and radio, but also shares her experiences with thousands of other women using these media. Now let's go to Malawi, where Hilda and many other women like her sit around a radio under a baobab tree. They are regular listeners of radio programs on maternal health from the community radio station facilitated by Paul. 2 years ago, Hilda's sister died while giving birth because she had no professional support and did not make it to the hospital in time. Hilda got a group of women together who wanted to do something about the high level of maternal mortality in the area. With Paul's support, they developed radio programs on issues related to pregnancy and delivery. Hilda smiles when songs on pregnancy and childbirth are aired. Hilda's group wrote and performed these songs. They listen to their own voices, their own stories, and their own ideas, which can transform them. Achieving gender equality is not just the responsibility of women alone. It must be the common concern of all humanity. Each one of us must contribute, and as Mahatma Gandhi said, let us be change we want to see. Thank you very much.
Imogan, ably represented by Barrister Imatiya Obanishagbon of the Great University of Benin. A round of applause, please.
The Rector, Federal Polytechnic, Auchi, and taking a clue from my prof, not wanting to breach any official protocol, I want to acknowledge the presence of everyone, particularly those on the high school and all who are out there. I want to thank the school authority for organizing a program such as this. It is timely. It is timely in that issues that are coming up that we are hearing are issues that we need to know about. I am not Dr. Winston Morgan. I am Imatiya Obanishagbon. Yesterday morning, Dr. Winston Morgan, who is supposed to have given this presentation, called me and said he had a national assignment in Abuja and needed to be there and wanted me to come stand in his stead. And I wondered whether I was fit and proper to do so. He reminded me of three things, and it is from that angle that I will start my presentation. Female genital mutilation is an issue that can best be looked at from three perspectives. And these perspectives include the legal aspect of the issue, the sociological aspect of the issue, because it is a social problem. It is also a medical issue. I'll be speaking to you as a lawyer. I'll also be speaking to you as a sociologist, and I also will be speaking to you as an associate medical doctor. Some of the images that we are going to look at, I know some persons laughed. I've been married for 21 years to a medical doctor, so that qualifies me to be a medical doctor. Let me advise, I don't usually like the word warn. Let me advise there are some images that will pop up on the screen, and via discretion, complete it. Thank you. Now, what is female genital mutilation? The word has different meanings to different persons. For one thing, some persons call it female genital cutting. In my place, they call it circumcision, and I'm sure they also call it circumcision in your place. Different name. Others will say that it is female brutality, and those who see it as female brutality and mistreatment, they are correct to a very large extent. By the time we finish with this presentation, you will know what we are talking about. We cannot go into the implication of a thing when you don't know what the thing is. So the presentation will take this format. We will look at the meaning. We will look at the reasons why people engage in it. Who are those that carry out this cutting? And what are the consequences? These are the three angles that we will look at them. And where appropriate, we will look at the enabling laws or the laws prohibiting it, and how effective they have been. We want to say that female genital mutilation is nothing but all procedures which involve the partial or total removal of the female genital organ, whether such removal is for a cultural or non-medical reasons. This definition was given by WHO, World Health Organization, and it has support in UNICEF. I'm not going to bother us for now about the anatomy of the female organ, but perhaps we will look at it much later. WHO, the World Health Organization, has done some classification of the female genital mutilation. We will also come to that later. The man, his hand, you can see the vein, he's holding tightly onto the child so that the child will not struggle. And there is somebody with a sharp razor blade about to do what he thinks is the needful. Is this needful? We will go to that much later. Now look at the hand of the woman who wants to do the circumcision, the blade. Are those hands sterile? Are they clean? The question or the answer will better be answered by you. Now, who does this circumcision? These are preambles. Now, in African society, in my place, which is your place and those things, there are certain persons that are met by procedure to carry out this. And these persons are elderly women who are accredited. Sometimes I ask myself, who accredits them? Who makes them to be the ones? They are elderly women in our society, and more painfully, they do not have any form of medical training. But interestingly, they are held in high social status. They occupy high social status. They are respected by the community members. One will want to wonder why they do that. Then who do they circumcise? For the purpose of this presentation, the ones that they circumcise, they are the females. And they do the circumcision or mutilation for those from the ages of 1 or sometimes less. At other times, it is when the woman has reached womanhood. Sometimes it is when the woman is pregnant before delivery. And they do it on children who do not know anything, who do not even give their consent. For the adult woman who is pregnant, she knows what she is going into, even though she may not like it, even though it is a crime against her. But she has to do so because the society in which she lives will mock her if she does not. The description is clear. During what we will call local surgery, the child is held down. The child screams and help looks onto the mother, and the mother is not doing anything. And they say that in our society, women are the ones that carry out this circumcision. Majority of those who mutilate are women. And Professor Mrs. Edema had said earlier on that women are not the problem of women. But I beg with all humility to differ a little, that in this aspect, women are the ones that will prevail on other women, that they must do it. I had my first child in 1994, and the person who brought me into this world, a woman, my mother, she's alive. She came to my house at about 6 o'clock in the morning. In my place, I would say 6 few morning. She came. And then what was the discussion? She said she wanted to talk with us. I have a policy with my wife. If my father comes, my mother comes, both of us will sit down together, they will speak. Luckily, they must talk to me in the presence of my wife. And so my mother said, Yabauga, let's go to inside the house. I said, Iye, Mama, talk. And then she now said, this is how I don't like it. If it were Mike, that's my younger brother, he would follow. So I said, well, it's okay. What do you want to say? He said, Ameze is about 7 months old, and that we must do circumcision for the child. I said, eh? So I now told my wife, maybe you should leave. Because in my place, it is the woman that is the problem, not the man. Now I told her to leave. I said, what did you say? He said, circumcision. I said, who do you want to do it for? You did it for me many years ago. Do you want to? She said, no, it's for your child. I said, if it is for my child, let me take the decision. He said, no, you must do it. Then I asked, have you found out the medical implication? And she said, there's no medical implication. So we battled. People who are listening, For 2 weeks, my mom will leave my dad in their matrimonial home and trek down to my house 6:30 in the morning for 2 weeks, trying to prevail on me. And I had no option but to call my dad and say, the woman whom thou marriest, talk to her. A child cannot outgrow the parents, so you cannot talk rudely to your mother. So I told my father to talk to the wife, and he did, because to an extent he had contact with Oyibo, so he knows what we were talking about. How do you say it in society that a medical doctor decided to mutilate her own child? How do you say that a university, as my kids will say, university does, will decide to mutilate, not does. It does not know how to pronounce things. So how do you say that? How do you say that a man who knows the legal implication decided to go against the law? I'm sure my lord or my lordship will sentence on to a term of imprisonment. Why do we do female genital mutilation? Why is it? Now I'm going to talk about it so that you know whether you now agree with yourself whether these reasons are cogent enough, whether they are authentic, whether they are reasons that we should buy into. If they are not reasons that we should buy into, today we will take a decision, we will take a stand, and we will make our position clear on the issue. Some of these reasons that have been found out, especially by researches done by a World Health Organization and some other persons and scholars here and there, they have identified about 5 different reasons why people carry out mutilation of the girl child. And these are the socio-cultural. We will treat the socio-cultural. There are tales about the effect of non-circumcision of a girl child. One of such, permit me to say, boju that they say, is that if a girl child is not circumcised, when she becomes a woman, she will blind all those who are attending to her during childbirth. Many of you are mothers. Did you blind any person? They also will say that female genital mutilation reduces infant death. Rather, I would rather say that it is female genital mutilation that will cause death of an infant. They say that it enhances fertility. There are no medical research to show this. Are they saying that all those who have not been circumcised have not been fertile? Of course, the answer is clearly in the negative. They also say that female genital mutilation minimizes the chances of getting tetanus and other childhood diseases. Where do you get tetanus from, sir? Is it not by cuts? So we want to take a stand today that these sociocultural tribal myths are not tenable in our today's society. We want to also go to the socio-cultural, the psychosexual aspects. Sometimes when people talk, they talk as if they are the only person in society that has knowledge. One of the reasons given by those who are proponents of female genital mutilation is that it helps to prevent premarital sex and preserve virginity. How true is this? They will say that an uncut clitoris grows bigger and activates sexual desires. Is that really? Are all those who are prostitutes, either by their making or by not their making, are they the ones that were not circumcised? Research needs to be done in this field. But I dare say, from a layman's perspective, that mutilating a girl child does not help, has nothing to do with premarital sex. And instead, we lay it at the doorstep of our mothers. If a mother brings the child up, when I use the word mother now, I'm using it in the plural sense, that is man and woman. But the primary responsibility rests with the woman because she is more with the child. If you bring up your child well, in the fear of God or in the fear of Allah, and the teachings that are in the holy books, your child will not engage in premarital sex. I had to caution my second daughter some time ago. I asked her to pick something from the chambers, and as she walked down, somebody was, to use your local parlance, toasting her. And my girl turned round, look at me. Do you think I'm ready for that nonsense? Wow, the boy's face. And I said, when she came back, she came and told me that as if she has achieved a PhD in slapping. That I slapped one idiot boy. I said, who is idiot? Is it God's child that you are calling an idiot? She said, no, but the boy was talking, was saying, let us. I said, you mean he was toasting you? She said, yes. I said, you should have listened and then with your mouth say, I'm not interested. Try somebody else. That as you slapped him, he would have slapped you back. And before you say, my father is a lawyer, they are beating you. And by the time I come, I will not even see the boy. I think mothers here present, we need as a matter of urgency to talk to our kids about sexualities. We need to let them know what sex is all about. I have done it even as a man. I sat at the table with my daughter, with my wife, and we talked with the two girls that God gave to us. And they were looking at my face thinking I would be shy, but I was the one that was talking more. And they were saying that you are very square. I said I'm not very square. How can I be square when I produce 4 of you? Mothers, please talk to your daughters about sex. Now, they also say that when you mutilate a girl child, then the girl will be faithful. The girl will not go, when she gets married, she will not commit adultery. There is no record, there is no evidence, there is no research finding in this area. And so we discountenance that and say that it's just something in the minds of our older women to perpetuate the act of mutilation. And then they even say that it is those whose job it is to circumcise that carries out this rumor. I want to also say that the third reason why some persons engage in mutilating their child is on the basis of hygiene and beauty. They argue, but most erroneously, that women's external organs are dirty and ugly. In other words, women's sexual organs are dirty and ugly. That is what they want you to believe. But if it is really dirty and ugly, gentlemen, why do we still go for them? It's not ugly. It is the finest place God created. Yes, they say the fourth reason given for mutilating a girl child is that it has to do with spiritual and religious matters. That when you mutilate a girl child, you are making the girl child spiritually clean. What does the Bible say about cleanliness and righteousness? Is it to mutilate? It has nothing, no bearing. They say Christians, Jews, Muslims, they practice it. Can someone in the congregation or in the high table tell me a portion of the scripture, Bible, that enjoins us to mutilate our girl child? Is there any in the Holy Bible? In the Holy Bible, of course, I have read the Bible and I have discovered that there is nothing. In Quran, I don't think there is anything there too. The last point on economy. They say that guests are rewarded with presents after operation. After you have mutilated, cut, injured somebody, you are now giving the person a gift. What kind of gift is that? They also say that non-circumcised guests have little or no chance of getting married. Who says? My wife was not circumcised. She is happily married. The time she should have married was when she married. My daughter will get married. The time she will marry by the grace of God. So it has nothing, no bearing. Having said all this, we quickly want to look at the implications. Every woman, every girl child has a right. Every girl child has a right to life, has a right to liberty and security, has a right to non-discrimination, has a right to personal integrity, has a right to be free from torture and other degrading treatment. And every girl child has a right to health. I'll take the first one. If you mutilate a girl child during circumcision and you make the mistake, or you make a mistake, and the girl starts bleeding, that from bleeding, if it's unstoppable, the child will bleed to death. And you have violated her right to life. Every child has a right to liberty and security. I have a right not to be circumcised if I don't want to be circumcised. For heaven's sake, why force me? Why pin my dead child to the ground and force her to engage in circumcision? Why do we discriminate in our society, in the villages, that this person was not circumcised? That is discrimination and it violates the Constitution. Every dead child has the right to personal integrity. The integrity that makes you as an adult. You are pregnant and somebody says you must be mutilated. Where then is your personal integrity? It is being violated. Every dead child is entitled not to be tortured. I consider, without missing words, that cutting off the clitoris is torture for the dead child. Some short-term effects of female genital mutilation includes this. There is pain. The picture we saw of that child first, you could see pain. Sometimes when you go to take injections, I don't take injection unless I'm about to die. Usually I'm never about to die. Because just that pricking of my bum is painful. The only time I have taken it, I had waist pain and I could not get up. And she told me, you must take it too. And I said, no. After 3 days of sitting down without being able to get up, I had no option. And that time she now made shakara that she will not give me again. So I called Dr. Wilson Morgan, who was very gracious. He came, he petted me. In fact, it took 45 minutes by his time to give me one Novocaine injection. Now, to carry a blade and cut off somebody, it's painful. It can injure the tissue in the female organ. And when it is injured, what do you say to the girl child? At other times, it leads to severe bleeding. It also leads to shock. The girl child is shocked, not just temporarily, but it can carry on into life. It can also lead to acute urine retention. For time's sake, I will not be able to expatiate. But more importantly, when they are pinning the girl child, permit the word, pinning the girl child down, it could lead to fracture. See the man's hand pressing the child. If the girl struggles, there could be a dislocation. Our people do not think of that. All they want is to cut. It also leads to infection. You bring blade that you used to do for Jeanette, you will use it to do for Angela, you will use it to do for Osaro. For heaven's sake, infection could set in. And our people are not difficulty in passing urine. If it is not well done, and most times they are not well done, it the girl child has problem of urinating later in life. Then there is the recurring infection. You begin to treat and treat. You will say it's toilet disease. It is what they did years and years. It could also lead to pelvic infection, and that's terrible. It could lead to infertility. And the one that concerns me the most, it could also lead to painful intercourse. Now it's been done and done badly. And then when you are now married, legally married, to have sex with your partner or your spouse, you cannot. You are always saying you have headache. And the problem comes. And sex is fundamental in marriage. There could be also emotional depression. Emotional depression. You can look at the slide, keloid formation. When it is not well done, whether well done or not, keloid, that's the part of a child or a female. And then you have bumps. When men use blade to cut themselves, shape, you see the bumps. Now imagine a girl child having keloids in her private organ. What life is she expected to live? Beyond that, it could also involve inclusion of cyst formation. And if that happens, how on earth can the girl child, have a child of her own? Gentlemen and ladies, I think that we need to stand and condemn this act. Even though the Edo State government has made a law several years against it, but I do know that it is still being practiced in our state. It is your duty, it is your responsibility. It is my responsibility to talk and ensure that this evil against female is stopped. And where can we stop it? We can stop it today by us resolving in ourselves that no to female genital mutilation. Thank you.